Hello everyone, I am Vidhi ANKLESARIA and I will be taking you through this video on Fluorescein-Guided Dacryops Excision technique. The lacrimal gland has a bilobe structure with its palpebral lobe located in close relation to the superotemporal conjunctival fornix. The aqueous part of the tear film is secreted into the superior conjunctival cul-de-sac via multiple ductular openings. The functionality and location of these ductules can be assessed by touching a fluorescein impregnated strip on the palpebral lobe of the lacrimal gland. The slow disappearance of the dye signifies patency of the ductules. This method is called direct assessment of tear secretion or DATS. Dacryops is a lacrimal ductular cyst and typically presents as a non-tender cyst of variable size in the superotemporal quadrant under the upper eyelid. It is smooth-walled and bluish-gray and tends to transilluminate. A simple preoperative fluorescein staining and DATS in Dacryops can serve as a great guidance to avoid damage to lacrimal gland ductules during surgical excision. Small asymptomatic cysts can be observed, whereas larger and/or symptomatic Dacryops need to be managed surgically. Marsupialization is often the preferred method wherein the cyst wall is incised and its contents drained, but the residual cyst wall tends to cause a high rate of recurrence. Thus, we choose the surgical technique of complete excision of Dacryops. Here is an intraoperative video of Dacryops excision which was guided by preoperative fluorescein staining. The patient is a middle-aged female being operated under local anesthesia. The functional ductules of the lacrimal gland were identified above the lesion. Thus, the conjunctiva overlying the cyst is incised inferiorly to avoid damage to the lacrimal gland ductules present superior to the Dacryops. The cyst is separated from surrounding tissue and is now being decompressed by aspiration of its contents using a 27-gauge needle and a 1 ml syringe. Following this, the cyst wall is meticulously separated from all the surrounding soft tissue. The cyst wall is then completely excised, making sure not to damage any of the functional lacrimal gland ductules. The overlying conjunctiva is then apposed using tissue glue. This is a pre- and post-operative image of the lacrimal gland region of the same patient. She was asymptomatic, had normal Schirmer values with no recurrence at 4 months of follow-up. Here is a pre- and post-operative image of another patient who was a young female and underwent surgery for unilateral Dacryops. The preoperative image of DATS in the inset on the left shows an arrow pointing at the patent lacrimal duct opening which served as a guidance during surgical excision. A patent ductule is seen in the postoperative DATS image in the inset on the right as well. Thus, fluorescein-guided Dacryops excision is a technique with low recurrence rates and a lesser incidence of causing postoperative dry eye in our experience. Thank you.